Please welcome Ms. Rima Gawan, Surgical Sciences. Our panel brings together a wealth of expertise to discuss how prevention can become the cornerstone of better healthcare outcomes. Rima ma'am, over to you.
Please, okay, fine. Thank you so much. So now gradually we are just heading towards last few session. And we know when we talk about crux in life or in such summits, they're always in last few sessions. So big round of applause to all my worthy panelists. We have with us Dr. Pragnya Chigurupati, sir. Welcome to you. Welcome, sir. Welcome. Dr. Chinna Babu Sunkawali, we have with us. Welcome to you. Dr. Vishwanath, Dr. Rajiv Paul. I'm so happy that we have such an empowered panel who is going to share their wisdom, their thoughts on one subject which is actually need of the hour. Our Honorable Deputy CM, while he was closing his statement, he very rightly said one thing. The most comfortable medicine is early detection, and that is preventive healthcare. India, which is bearing 20% of diseases in the world, you think how important it is. I would like to start with Dr. Pragnya. Early detection remains one of the most effective tools in the fight against cancer. What are the biggest gaps in awareness and screening that needs to be addressed today?
Good evening, and I'll just start off by saying two things. In India, it's not only rural India who's suffering with lack of awareness, it's also urban India. And through the foundation that I run, what I understood is that obviously it's a huge taboo talking about the word breast health, and besides that, it's also a stigma. There's obviously lack of awareness. There are lots of things that we as individuals, individual doctors have to do, as well as the government also needs to step forward and try to sort of get this stigma out in the in rural, predominantly rural India.
So, but the message goes there, message reaches there. What should be done for that?
What message? Oh, to get there.
Yes.
So there's so many things that the government can do. For example, even Dr. Chinnababu also runs a foundation. So both of us do these things of sending mammogram buses out to rural India and then urban India. Different women, all sorts of women are screened, and if there's something, we make them aware of what has to be done. And this is from a private sector. This is an NGO, right? The government also has to be able to send these buses out. First of all, create awareness amongst all these women, and then tell them what a mammogram is, what an ultrasound is, get them done at the right time, and then make sure they follow up also. And then this is one cycle. It has to be continued because women have to be screened every year. So it has to go on even the next year and then year after year. So the government has to come up with so many different techniques. And then NGOs like ours also there should be more of them, and it should go out to different women, different kinds of women in different sectors, and then educate them besides just screening them.
It's about execution and continuous follow-up as well.
Absolutely.
Definitely. Okay. Dr. Chinna, my question is to you, because when we talk about cancer, unfortunately, India stands at number 3 in the world. So that's the most unfortunate picture we have right now. And we see that despite advances in treatment, all the new technologies, still we are diagnosing certain kind of cancers in their much advanced stage, where treatment becomes, if I say next to impossible, won't be right, because at the end, we really don't have anything in hand. What can be done to shift the focus from treatment to prevention and, most importantly, early detection?
Well, the great question. Thank you for having me here. I think, as rightly mentioned, 70% of the cancers today that we detect in this part of the world are in advanced stage. So now, what do we do to detect early? Right? I think, as Dr. Pragnya has mentioned, I think raising awareness is the key. Number 2 is access to screening at their doorstep. I think that is something that, is very close to my heart. For the last 14 years, we've been able to go to the doorsteps to the Grace Cancer Foundation and, touch about 100,000 screenings every year is what we have committed. But that's again a small drop in the ocean. So I think initiatives to detect the disease early is the most important step that we need to take, both raising awareness and screening at their doorstep. I think these are the two things. With the policy help, can be the effective strategies to really, detect the disease in early stage. So unlike in the West, I think we need to tilt and make that shift for early detection, because as we all know in oncology, the outcomes depend on the stage of the disease. So earlier the diagnosis, better the outcomes. So I think that's where we need to have the policy with us, and also the awareness drives and the community screening. Especially, in a country like ours, we can't screen everybody. So we need to look at prioritization. We need to look at the high risk groups and do the screening at their doorstep. I think that is very crucial in order to detect the disease very early.
Exactly, very right. And the biggest challenge is actually our population, I think, because even our smallest sample size requires so much of resources to reach there. That is there. So my next question is to Dr. Vishwanath, because nowadays we see lifestyle-related diseases are increasing, and hypertension, diabetes, obesity, and it's contributing to vascular health diseases. What preventive measures you suggest can individuals adopt today to reduce long-term cardiovascular and vascular disease?
Oh, yeah, hi. So when we talk of an individual has many facets. So take me as an example. I'm a father, I'm a husband, I'm a friend, I'm a physician, I'm a boss, and sometimes all these things before lunch. Okay? So I cannot ask my child to, not eat junk and order something from concert, 11 o'clock, watch a movie. So I just start there. Okay? So we should have friends who not only take us to bars and pubs, but also to gyms. Okay, as a BAS, we incentivize our staff based on how healthy they are. So in fact, we stopped increment for one of our staff members because his BMI is not in the range. So it should start there. And as an individual, if there are 5 things which we need to do: no tobacco, take care of your sugars, maintain a healthy BP, walk, keep moving. Your blood, yourself, and your cash, all of them should be in flow so that you're not stuck somewhere. And also maintain an ideal body weight. And if these 5 things are taken care of, and you be a better family member, friend, and an individual, I think most of the things are sorted out, and we'll be building healthier futures, healthier generations.
Rightly said. And from there, I come to you, Dr. Rajeev. As we discuss chronic health conditions, and most of them are lifestyle diseases, which gets definitely worsened day by day. So I think it lacks that we take ownership of our health. Even like after pandemic, we saw the people were getting comparatively aware about their health. But where we see this lacuna, where we see that big gap, which is still we are not able to fill.
Thank you for this invitation to be the part of this panel. And the most important thing that I feel is we have to come out of the mindset that doctors are the floggers. We should not flog our patients to achieve goals. And that's most of the doctors still do. We tell them, okay, you are a diabetic, you have to reach your 6.5 or 6 HbA1c. But it is not that everyone can achieve that. It's not easy for the patient. Somebody who starts with somebody of HbA1c of 8.5, and you tell them tomorrow you start eating this diet, tomorrow you start 50 minutes of 30 minutes of exercise, and you start yoga. It doesn't happen that way. The biggest challenge is the doctor should lead as a friend, as a philosopher, and a mentor. So we have to basically intensivize our patients in such a way that we give them small goals. The whole target is we have to reach our goal, yes. The doctor knows it. It's not putting the challenge on the first day to the patient that he meets you. You have come to me first time, you have to reach this goal. Obviously many patients after some time fatigue out. The fatigability is a major factor in chronic diseases. So it is not treating something for a pneumonia that I treat for 7 days or 10 days and it's over. It's a lifetime journey for a patient, and you can't put the patient into fatigue. So have small goals, have the longer perspective in mind that yes, you have to reach the HbA1c desired for the patient, but give them small targets, achievable targets, and involve them in the care. The most time is that doctors don't involve the patient in the care. For example, if I tell a patient to do 3 things at a time, you eat a less carbohydrate meal, do a 30-minute exercise today, and then sleep well, all at one time. It doesn't happen that way. You tell them, what would you like this month to be done? Would you start off with a low-carb diet or more of a yoga this month? Give it the
practical targets.
Yes, practical targets, and leave the onus on them. Let them slowly incorporate them into their lifestyles. And you see their acceptance to this will slowly improve. So giving rigid challenges or rigid numbers or rigid statistics will never help at the end of it achieving the goal of total health care. that is where I feel, I mean, we as doctors should become more part of the patient-centric care rather than the patient-flogging care.
Right, very right, and very practical thing came from you, Dr. Rajiv. Dr. Pragna, my next question is again with you, because I see that healthcare providers have major role to play, seeing the current picture, particularly women, because they always keep their health on the back seat, prioritizing so many other things. So how do you see that? Because it's a challenge again, because as I was discussing that our population is one of the biggest challenge. And as I said, that even our smallest of sample size is something we need great resources for. So what do you see that, is it a challenge for organizations like you who are actually working on the ground level?
Yeah, absolutely. As mentioned earlier, it's impossible to go ahead and screen like, the UK or the US does. They send letters out to everybody and make sure they get screenings done. It's impossible. So what we do is opportunistic screening. And so if we are at least able to, sort of spread the message saying that this is wrong, this is wrong. We have so many tiers, right? There's ASHA workers, there's Anganwadi workers, there's so many of them. So what we have done last year with the foundation is that we have associated with the government at that point. And so we started screening Sangha Reddy. And the local commissioners, all of them are completely in sync with us. The number of people who have been coming to our camps have doubled after the government got involved. Right? So even if our organizations want to do as much as we can, unless we get the government support and spread this word out, saying you have to come, get it done, that's also opportunistic screening, because it's not like it's not a compulsion for everyone to come. They still just walk in, whoever wants to come, whoever doesn't have a job. During those screenings, what we also do is, if you don't want to come, your mother doesn't want to come, please at least ask them to examine themselves. We teach them how to examine themselves. Beyond this, there's nothing else we can do, because at the end of it, we can't just drag a woman out and say, come, let's do your breast screening, right? So all that we can do is, to face these challenges, is tell them it's very, very treatable. I'm talking about breast cancer specifically. It's very treatable if it's in the early case. So please, please, please come out. And that's exactly what we're trying to do. Government support has helped us a lot, though.
Because then when we talk about early detection, I think we really need to see what best options we have. So Dr. Chinna, my next question is there, that what role can technology, AI and predictive analysis can play? Because when we see such efforts are happening, so to enable such healthcare practices, what role AI and preventive healthcare can play practically?
It's not yet there fully, but I foresee that eventually it will lead us to a position wherein we can detect the disease very early with the use of AI. Just to give a small example, like, if all your healthcare data can be analyzed and, alerts can be given to you, then, you can diagnose the disease early. So I recently coined a word called precursor oncology. So the precursor lesions are there. If you identify them even before the disease comes, even before the symptom comes, through multi-omics or a lot of AI analysis of, your blood sample, you are able to actually identify the disease much, much earlier, even before any of the screening tests can identify.
What are they, if you could share with us briefly, so that more and more people could know what are those tests, or what are those preventive measures?
No. At this point of time, the only test available is a single blood-based test to identify multiple cancers through metabolomics, and the AI-driven, the algorithms are able to diagnose. But at this point of time, I don't want to confuse. This is not the gold standard or the standard of care.
All right.
But this is something that is showing 99% specificity, including the tissue of origin of the tumor.
The probability is high.
Very, very high. So I think eventually AI is leading us to a simple blood-based screening test, for multiple cancers at one go. So I think that's where we are heading to.
Right. And Dr. Vishwanath, how can healthcare system better integrate preventive health assessment into routine clinical practice rather than just waiting for symptoms to appear?
Oh, yeah. So I think, thanks for that question. That word integration is the key. We have enough of innovation, but not enough of integration. Okay. So I think this is a paradigm shift in how we organize, deliver, measure, and incentivize healthcare delivery systems. So when we build our Ikigai hospitals, we don't call it a specialty-based hospitals, though we were awarded the same. So it's an integrated practice unit where the work starts with our community outreach programs on educating the general community about how to take care of their feet, how to prevent amputations, how to prevent ulcers and all. Okay. So, and then when you enter the hospital, under one roof, we have everything that is required for management of a patient with diabetic foot. So they don't have to run around. So we need to create healthcare systems which are centered around patient's convenience. Because that's the key. We don't want them running around 10 floors or 15 floors for one specialty and to get an X-ray to another specialty, for a scan to another street. So that's how we organize. We reach out to the communities, and also the healthcare incentivization. People who go for preventive checks should be incentivized, because most of our insurance companies, they incentivize or they reimburse for management, not for prevention. So that needs to change. People who are health conscious should be encouraged to do so that the healthcare costs as such, they come down. I think these changes needs to get integrated, and all the healthcare risk factors or conditions with similar risk factors, they should be bundled together.
Right.
Because if obesity is causing so many diseases, you can't ask a patient to go for vascular checkup to one center, neurological checkup to one center, but they may come for their sugar checks regularly. So if you can integrate and bundle all these packages or screening programs together, I think it will be of a lot of help to patients.
I think very, very right suggestion. Thank you so much. Dr. Rajiv, my last question is with you, then we'll close this panel. There's something problematic with our attitude. I think we focus on illness. Preventive healthcare is still I think, one of the last option. What do we need to change this attitude? I mean, how you see this gap is to be filled?
Yeah, preventive healthcare is something which is, again, I told you, it's a long-term, long-driven process. So it's a public and a partnership with the government and the private sectors. All three are the three major stakeholders in this. I mean, you can't tell the public to do something and the government or the private sector just is not into it. So as the cancer awareness programs going on, similarly diabetes awareness programs going on, yes. So there's a lot of funding required, lot of manpower required, lot of time required. So unless a structured program is developed for this by all three stakeholders, the public, prominent people from the public, the government's setup, and the private hospital, the network that we have, this is not going to sustain in the long run. Remember, we are still a rural society. Our urbanization is not a very high level. So to reach a rural level and to maintain that level, we need a significant amount of manpower and resource, which only government really can back up with us.
Right.
So significant amount of government support and monetary support will be required to achieve this in the long-term goal.
I think inclusive efforts
Yes.
is the need of the hour. Thank you so much. I just wished we could have taken this discussion to the next level, but time crunch. Thank you so much. Thank you so much for your wisdom, for your expertise.
Ladies and gentlemen, if you can please give a huge round of applause to our panelists and our moderator. Rima ma'am, I would request if you can please stay back on the stage for this absolutely fascinating and eye-opening discussion.